Imagine this. You're enjoying a quiet afternoon. Maybe you're reading, knitting, gardening, or scrolling through your phone. Everything seems normal until something strange happens. Out of nowhere, part of your vision changes. A faint shadow appears just at the edge. It moves when you move your eyes. It's not a smudge on your glasses, it's not a piece of dust. And then it grows. It's like a dark curtain slowly being pulled across your sight. Your instinct might be to rub your eyes, to blink hard, hoping it's just a trick of the light. But it doesn't go away. This is the moment that matters most. Many people, even those who are careful about their health, make the mistake of waiting, telling themselves it will clear up in the morning. But with certain eye conditions, waiting can mean permanent damage. The difference between acting now and acting tomorrow can be the difference between saving your sight and losing it forever. That's why today we're talking about 4 urgent warning signs that should send you straight to the eye doctor. No delays, no, I'll see how it feels later. If you notice these symptoms, you need to act immediately. Before we dive in, if you care about protecting your vision and keeping your eyes healthy for years to come, make sure to subscribe to this channel, give this video a thumbs up, and share your own experiences in the comments below. Your story might help someone else recognize a dangerous symptom in time and save their sight. You're looking at a clear blue sky, and suddenly you see tiny specks or squiggly lines drifting in your vision. You blink, but they don't go away. They drift when you move your eyes. And when you try to look directly at them, they seem to dart away. These are known as floaters, and in many cases, they're harmless, caused by small bits of collagen or protein clumping together inside the vitreous, the gel like substance filling your eye. Over time, especially as we age, the vitreous becomes more liquid, and these clumps cast shadows on the retina, appearing as specks in your vision. But here's the danger. A sudden increase in floaters, especially when combined with other symptoms, can be an early sign of retinal tear or detachment. This is a serious emergency. The retina is the thin, light-sensitive tissue at the back of your eye that sends images to your brain. If it starts to tear away from the supporting tissue, it loses its blood supply. Without oxygen and nutrients, retinal cells begin to die within hours. Imagine peeling wallpaper. At first, only a small section lifts, but leave it and the peeling spreads, making repair harder. The same principle applies to your retina. The longer it's detached, the lower the chances of restoring vision fully. The rule is simple. If you suddenly see more floaters than usual, especially accompanied by flashes of light or a shadow in your vision, don't wait for an appointment next week. Go to an emergency eye clinic today, because the next symptom we'll talk about often appears alongside floaters, and it's even more alarming. Have you ever had a camera flash go off in your face and leave a bright after image? That's normal when a real light source causes it. But what if you see flashes when there's no light at all? These flashes, called photopsia, often look like lightning streaks, sparkles, or camera flashes in the corner of your eye. They can appear randomly, even in a dark room, and last only seconds. But their cause can be anything but harmless. Inside your eye, the vitreous gel is attached to the retina in several places. As we age, the gel can shrink or shift, pulling on the retina. That tugging stimulates the light-sensitive cells, tricking your brain into seeing light that isn't really there. If the pulling is strong enough, it can cause the retina to tear. And that's when the real danger begins. A torn retina can quickly progress to a full detachment, cutting off blood flow to part of your eye. The damage from this is permanent if not treated immediately. Flashes can be your first and only warning before irreversible vision loss begins. Some people mistake these flashes for migraines or simple eye strain. While those conditions exist, it's better to let a professional rule out retinal problems rather than assume it's nothing. If you ever see sudden flashes of light, especially with new floaters or a shadow creeping into your vision, don't wait. Seek urgent care. And speaking of shadows, our next symptom might be the clearest sign yet that you're in the middle of an emergency. Imagine standing by a window, looking out at the street. Everything seems clear until part of the scene disappears. It's not like closing one eye. It's not a smudge on your glasses. It's a definite area of missing vision, as if someone pulled a curtain across part of what you see. This is one of the most urgent red flags in eye health. When a shadow or curtain begins to sweep over your vision, it often means retinal detachment is already in progress. By this stage, the retina is no longer fully attached to the underlying tissue that feeds it oxygen and nutrients. Without that lifeline, the cells begin to die. People describe this in many ways, sometimes as a gray shadow creeping inward, other times as a dark veil dropping down, or a smoky fog slowly spreading from one side toward the center. It may start small, barely noticeable at the edges, but it can expand with terrifying speed. Hours can be the difference between saving vision and losing it permanently. The danger is amplified by the fact that the retina has no pain sensors. There's no sharp sting to warn you. The only alarm is what you see, or what you suddenly can't see anymore. And once the cells in the detached area die, even the most advanced surgery can't bring them back. If you ever notice this curtain effect, especially after seeing floaters or flashes, treat it like a full-scale emergency. Stop what you're doing. Don't wait to see if it clears up. Get to an emergency eye clinic right away. In situations like this, every minute truly counts. The retina can quietly fail without pain, but the cornea is the opposite. It's one of the most sensitive structures in the body, packed with thousands of nerve endings. Even the smallest injury can feel unbearable. A corneal abrasion is a scratch on the clear protective dome at the front of your eye. It can happen from something as small as a grain of sand, an accidental poke, or rubbing your eyes too hard. At first, it may seem minor. The eye might water, sting, or feel gritty. You might think, I'll sleep it off. But here's the risk. If bacteria get into that scratch, you could develop a corneal ulcer, an open sore that can permanently scar your vision. In severe cases, untreated ulcers can even lead to blindness in that eye. One telltale sign is photophobia or extreme light sensitivity. If suddenly even indoor light feels harsh, or you find yourself squinting in dim settings, it's a warning you shouldn't ignore. Combine that with persistent pain, redness, or blurred vision, and you need urgent evaluation. Unlike some retinal issues, corneal problems can worsen rapidly within 24 hours. The earlier you start treatment, usually with antibiotic or antifungal eye drops, the better the outcome. And remember, you don't need to be hit in the eye for damage to occur. Contact lenses worn too long, dust storms, or even aggressive eye rubbing can set the stage for injury. Bottom line, if your eye suddenly hurts and light becomes unbearable, don't wait. See an ophthalmologist right away. At first glance, retinal detachment and corneal injury seem like two completely different problems. One happens deep inside the eye, the other right on its surface, but they share a crucial similarity. Both can steal your vision permanently if you delay treatment. Retinal detachment can take away part or all of your sight in as little as a few hours. The longer the retina is without its blood supply, the lower the chances of a full recovery. Even successful surgery might not restore your vision to what it was before. Corneal injuries, on the other hand, can progress from a small scratch to a full-blown ulcer shockingly fast. Within days, or sometimes just overnight, the infection can dig deep enough to leave a scar, permanently blurring your vision. The sad truth: many people lose their sight because they assume the symptoms will fade. They wait, hoping for improvement, only to find that they've passed the window for effective treatment. This is why ophthalmologists stress the better safe than sorry approach. If you're unsure whether a symptom is serious, it's still worth an urgent check. An exam might reveal nothing more than a temporary irritation, but if it's something worse, you'll be glad you caught it in time. Vision is one of the senses we rely on most, yet it's also one we often take for granted until something goes wrong. Your eyes are small, but their systems are complex and incredibly delicate. Once damage occurs to key structures like the retina or cornea, it can be irreversible. That's why speed is everything when it comes to eye emergencies. If you notice sudden floaters, flashes, a curtain over your vision, severe pain, or intense light sensitivity, you shouldn't wait to see if it improves. Go to an emergency eye clinic immediately. If your area doesn't have one, go to the ER. Most hospitals can connect you with an on call ophthalmologist. You might wonder, what if it's nothing? That's fine. Eye doctors would rather send you home with peace of mind than see you days later when the damage is done. When you arrive, be ready to explain exactly when the symptoms started, how they've changed, and whether you've had any recent injuries or surgeries. The more information you give, the faster they can act. Treatment for these issues has the highest success rate in the earliest hours. In the case of retinal detachment, surgery within 24 hours can be the difference between full recovery and permanent loss of vision. For corneal injuries, prompt antibiotics can stop infection before it scars. The main takeaway? Don't gamble with your sight. Acting fast doesn't just give you the best chance, it may be the only chance. Floaters, flashes, a creeping curtain, sharp pain, blinding sensitivity to light. None of these are just normal or just aging. They are red alerts from your eyes, telling you that something is seriously wrong. The cruel thing about many vision-threatening conditions is how quietly they can begin. They don't always cause dramatic pain or obvious changes until it's too late. That's why knowing these warning signs and reacting quickly is your best defense. I've seen too many stories. People who waited just a little too long, thinking they were saving time or avoiding a false alarm, only to find the damage couldn't be undone. I don't want that to happen to you. So here's my challenge to you. Make a promise right now that if you ever notice these symptoms, you will act immediately. No hesitation, no waiting. And before you go, help us spread this message. Subscribe to this channel for more vision-saving tips. Hit the like button so YouTube shows this video to more people. And most importantly, share your own experiences in the comments. You never know. Your story might be the one that convinces someone to get help in time. Your sight is priceless. Protect it with everything you've got.